Yes, I was called in to see one person in Yarswood as an expert psychiatrist with a specialization in PTSD. I run a service in London where more than half my patients are asylum seekers and refugees. I was asked to see one of the people that Dr. Arnold has mentioned, who was arrived in this country and said that she had been tortured and raped in her home country. The Home Office rejected this as untrue and had her fast-tracked into Yarswood. After some time, this woman became so depressed, she attempted to kill herself by not eating and drinking. Then she joined the hunger strike with the other ladies. And the failure of treatment in the hunger strike by Yarswood was noted by Dr. Arnold in that they did not examine her for at least 14 days medically. No blood tests, no urine samples were taken. Then when he saw her, he was very concerned, had her admitted to Bedford Hospital because she showed the signs that he has mentioned due to lack of hydration and other complications. During her stay in Bedford, she was hydrated and she gave up the hunger strike. And then Dr. Arnold had to fight to keep her in there for long enough, but she was sent back to Yarswood for refeeding. Now, refeeding is a very important issue. You have to do it carefully to avoid the problems that arise from vitamin deficiency, and that is what can lead to a condition called Wernicke's encephalopathy, which happens often in alcoholic people. And that condition is a condition where the individual has a problem with seeing, walking. She sees double vision, she cannot walk steadily, and on top of that, the memory gets gradually worse and worse, more and more impairments. When I went to see this woman in October, I found that she had full-blown Wernicke's encephalopathy, therefore due to a failure of management of the hunger strike. On top of that, she had post-traumatic stress disorder. And not only was it to do with what happened to do with Uganda, you can tell the content of someone's trauma by the nature of the flashbacks that she had. And the other thing that came out is that she kept on saying that the men, the officers in Yarswood were in her flashbacks. I then found out, and it was written in the note, that an illegal deportation attempt had been made, a removal direction as they call it. And this woman had been re-traumatized by that to such an extent that she was visually seeing it. These people mixed up with the Ugandan soldiers, so she'd been traumatized. I found her so ill, so confused. She was also psychotic, so she had visual hallucinations of people coming to attack her. So she was so sick, I had her admitted as an emergency back to Bedford Hospital. And there, I asked them to investigate for a Wernicke's, because it's a very serious condition, to treat her for her post-traumatic stress and her psychosis. Fascinatingly, she was treated for Wernicke's, but the diagnosis was refused to be made. Fascinatingly, PTSD was actually mentioned as a possibility, but not in relation to what had happened in Yarswood, only in relation to what had happened in her home country. She was sent back much too soon, back into the center, and of course, because the people involved in the center are the very people who traumatized her, the officers, her condition got worse. So finally they took it upon themselves to do what they should have done, which was to send her to another place, which was Luton, a place in Luton, which is a forensic unit. And there, finally, the people who were involved in traumatizing her were out of the way, and she made some recovery. But again, the investigation for Wernicke's was not carried out. In fact, the diagnosis was refused. Again, the post-traumatic stress disorder in relation to all the things she'd been through, both at home and abroad, was denied. And the diagnosis of a psychosis that I had made was also denied. But as a result, interestingly, she's sent back again to Yarswood, and this is very important. The result is she has no confirmation of the diagnosis are all refused. So Vernix is refused, PTSD is refused, psychosis is refused, but the treatment for the conditions is prescribed. So, the conclusion of this, of course, when she gets to Yarswood, they can't treat her properly because she's so sick she can't get to the medical center, so she doesn't get the thiamine medication she requires to get better, so this woman is going downhill every day, with irreversible consequences if not dealt with soon. My conclusions are, very quickly, as I have half a minute to tell them, are that we need independent monitoring of the service in Yarswood by outside people as to health. We need to investigate the collusion of NHS staff who are beginning to collude in a very unethical way with the government. You are not allowed in the NHS to prescribe things that you do not diagnose for. It is actually completely contrary to medical practice, and I think that's going to have to be taken up, and I will be part of that. And on top of that, what is very interesting is no examination in the NHS is ever done without the guards being present in the room. So you can imagine what kind of investigation you are doing in the NHS. So those are my points for today.